Namaskar. Thank you. Today I would like to talk to you a little bit about an e-learning program that I teach, and it's something that I'm quite passionate about because my main work in life is actually working as a practitioner, and I see patients generally every week, and I spend the rest of the time teaching or writing. But the patients are my true love, if we can say that. I like working very much with people and offering remedies. And I've spent the better part of the last 30 years immersed in Ayurveda, and the last 20 years trying to adapt Ayurveda to Europe, where I live. And what I structured a course about 10 years ago, and I taught that course for 9 years in a classroom situation, 8 years actually in classroom situation, traditional, where you stand at the front and you draw on the board and you put PowerPoint and you do all these things. And then last year started in September 2014 to offer the same course as an e-learning program. And what this course involves is applying a textbook which I wrote on using medicinal plants, mostly Western medicinal plants, but also Indian medicinal plants, to the treatment of disease. And what I discovered when I first tried to teach phytotherapy, or the use of herbal medicine to my students 15 years ago was, we were going plant by plant, and then talking about formulas, and I'd watch everybody fall asleep in the class. And I discovered this almost 10 years ago. This methodology was applying herbs to problems that we have in life. So what I did is I start with health of a woman, health before conception, during pregnancy, after birth, postpartum, the treatment of children, then the treatment of adults, and we'll go through first everything concerning pregnancy, then pediatrics, treating babies, treating young children, then going into teenagers, then going into adulthood, and then working on women's health, gynecology, premenstrual problems, menstruation, treatment of cysts, tumors, fibroids, going into difficult problems like endometriosis, of which I have a lot of success treating, and then going into premenopause, menopause, etc. And then dealing with men's health. We don't generally get so much information about how to treat men. Take, ashwagandha, and that generally is the extent of it. There's many things we can do for men. And then I go into rasayana therapies of treating when we reach our golden age, which I'm right on the brink of going into my golden years now. And so how to use rasayanas in the later years of our life, and rasayanas for the mind, for the body. And then I do also some lectures on vajikarna, which are aphrodisiac fertility lessons. And then we touch on some metabolic diseases, digestive disorders of, diabetes and these kind of things. And we pretty much covered the whole realm of human life. And throughout this process, not only do I use, I've got about 180 formulas, more 190 formulas that I've just published in a textbook, which is volume 3 of a series of textbooks which I've published for schools and serious students. But I also have written a number of new formulas, and we also look at herbs that are not in my textbook of Dravya Guna for Westerners. And we apply that knowledge of using plants in a very practical application. How do we, work with patients that have this problem and that problem? And because my e-learning courses are interactive, the students will, come back to me and say, look, I have a patient that's 32 years old and she has this problem and that problem, and would it be appropriate this and that? And we also talk about that. And, we put it into the context of whatever lesson we're studying and the herbs that we're studying in the context of those treatments. And I feel that this is a much better way to learn herbal therapies because I give the students the monographs and they have the information of the herbs and they have a variety of formulas, but it's more, putting into context that whole clinical application of how do we diagnose this problem, how do we discover which dosha is causing this problem, and when we discover which dosha is causing this problem, which dosha is implicated in the pathology, probably through, ownership of a dhatu or a gland, an organ, a shrota, something like that. And this methodology is working very well. I offer this course every year to students. Students don't have to have done their study with me, their primary studies. They can have studied at other schools. If you're one of those people who's looking for a course to develop your clinical skills and to learn more about using medicinal plants, especially Western medicinal plants according to Ayurveda, and formulas, I give my students hundreds of formulas and how to use them. We also have a lesson in this about traditional Indian formulas as well, because there are some that are available in the West, depending on which country you live in. Some countries have more available than others, some countries not at all. So, it's quite a broad range of tools for serious students who want to develop their clinical skills. And I have, 28 years of clinical expertise, we could say, although it sounds funny to say that because I feel that I myself am a student, and my best teachers have always been and always will be my patients, because they keep bringing very strange and bizarre pathologies, and to that I'm grateful, because it causes me to expand and learn and to keep an open mind when I'm working with people, because that's life. Life is always new, and it's always a discovery. Well, thank you. If this talks to you, then I'm happy. And if it doesn't talk to you, I'm also happy. Namaskar. Thank you.